for me was really a couple of reasons of why I chose to get the vaccine. So number one for me was I believe in science. So I did research, I sought medical advice from some of the best colleagues here at Texas Children's Hospital in the world, and they highly recommended for me to get the vaccine. And then also the second reason was for my daughter, my family, my community, and my patients here at Texas Children's Hospital.
It's a game changer. I want to be covered, health-wise, and also, interacting with the kids every day. Anything that I can do to help them and help turn this disease back the other way.
I feel like it's my small part in doing something to help end this national pandemic. I'm so thankful and grateful that Texas Children's makes it really easy and accessible for us to get the vaccine. I think that's a blessing for us here who work here. I'm not a clinician, I'm not working bedside, but I am at meetings and things, going through the hospital, walking through sometimes units here or at partner hospitals of ours in the community. So I feel like I need to do what I can to keep myself and my family and community safe.
I felt like it was an honor for me to be able to get this vaccine when so many Americans at that time were not able to get it. And so when I went in for my first vaccine, I felt privileged, and I felt like I was doing my part for my community and our global society. And so when I got the second one, I even felt more better, or if it not better, because I knew that I had this vaccine, that I was keeping myself safe, my family, my community, and my patients here at Texas Children's Hospital.
When I received the first dose, the only thing I had was just a little soreness at the injection site. Other than that, I did fine. Took a little Advil, no problems. When I received the second dose, I didn't even feel no pain at all. Not even soreness at the injection site. I had other co-workers and friends that, had a few days episode where they felt really bad. But for me and my experience, I didn't have any of that. It was pretty flawless. I was ecstatic just to know that I had something that was going to provide coverage for me and protection for me. And at the same time, I'm very thankful, I'm very grateful. But I also wanted my other family members and friends to feel what I felt by also getting this vaccine, because we need this in order for to turn this the opposite direction.
I had side effects of optimism and hope. But physically, I did have a bit of injection site soreness with the first dose, just in my arm. With the second dose, about 12 hours later, I did feel a bit of flu-like symptoms. Just some muscle aches and chills, no fever. But if anything, it actually gave me a bit of confidence, or I was glad, my body seemed to be reacting to build up some immunity.
I think for me, I'm very hopeful knowing that, now they have these massive hubs available to so many of people who and otherwise wouldn't be able to get this vaccine. So I just say, continue to do your part, mask up, proper hand hygiene, and get the vaccine.
Enter into a new year after 2020 was a year that I think that we all will remember. But 2021, we are so looking forward to, number one, we have a vaccine. There is hope. And as long as there's hope, we have to do our part to keep the dream alive.
I actually went to TCH West Campus to get my vaccine, and especially dose 1 in December. I love the environment they had. It was like a big party. They had music and Post-it notes where people could write up on the wall just their hope, what this vaccine meant for them. Just being able to get back to hugs and seeing each other's smiles, and a bit of sense back to where we were in terms of being able to interact with each other in person, in groups. And so I'm looking forward to being able to get back to that.
I would tell anybody, if you have the ability to get the vaccine, to get it, for it to save our family, our family, our sisters and brothers. I think it's really important that we all do our part to get the vaccine so we can go back to normal.
I would say that a lot of smart people in this country and in this world put a lot of work and effort into getting this vaccine. I know that it's very safe and it's very effective if we all get on board and do it together.
Do your research. If you have questions, there are many people who have availed themselves to make themselves available for answers and to discuss. And just like I'm not a CPA and I work with someone to do my taxes for me, I'm not an expert in this arena. However, we are very fortunate to work with a lot of amazing scientists and medical professionals who really know this very well. And I've consulted with them, and I would encourage others to do the same to get answers to their questions from trusted folks that we admire and work directly with here at the hospital.